The matrix grid question is a decision matrix. It's the equivalent of several questions in one. That's okay though. Honestly, you just have to break it down piece by piece, take your time, and focus. Let's take a look at one of these. Maybe even pause the video and write down things that seem important as you read the case. So your progress notes at 10 o'clock read, the client is a 55-year-old female with the diagnosis of recurrent breast cancer with metastasis to bone, pelvis, and L2-3 spine. Right radical mastectomy performed 6 years ago, and client has a baseline +3 lymphedema of the right arm. Cachexia present with weight loss of 5 pounds, 2.3 kilograms in the past month. Chemo-induced chronic anemia is being treated with erythropoietin weekly. Baseline hemoglobin 2 months ago is 8 grams per deciliter. Client completes a cycle of palliative chemotherapy 1 week ago and presents to the oncology clinic for follow-up assessment and blood work. Client reports that pain, nausea, and fatigue are greatly impacting quality of life despite treatment. The client reports an interest in engaging in traditional Asian and North American indigenous wellness practices to help lessen the nausea, pain, and fatigue, and also avoid medication side effects. The client specifically identifies acupuncture and sweat lodges as practices she would like to explore. What you'll see next is 3 questions. So let's take a look at them. Which assessment findings or client characteristics are evidence of an increased risk for infection? Participation in acupuncture, participation in the sweat lodge ceremony, ANC of 900, a hemoglobin of 8.2, platelets 50,000, treatment with an opioid, albumin 2.7, or BP of 92/50. Which assessment findings or client characteristics are evidence of an increased risk for bleeding? Which assessment findings or client characteristics are evidence of increased risk for a syncopal episode? Now go ahead and take a look at this in that matrix grid style of question. This should be a great start on answering this style of questions. Take your time, focus, you've got this.